This is a short introduction to peer coaching in healthcare practice. My name is Adele Kane. I'm Associate Head of School for Placement Learning. So we're thinking about peer coaching, and it's a process through which you would reflect or work together on current practices. Maybe think about your skills, expanding, developing those, thinking of your ideas to teach one another and to problem solve. Using skills of clinical decision making and clinical reasoning to support what you're doing. So what does that mean for student nurses? Well, student nurses and midwives probably coach each other informally, and I'm sure you're thinking, well, yes, that's right. You reflect together on learning experiences and give advice, and may even have given each other feedback when working together in clinical simulation sessions or during case study groups or group discussions or supervision. So why are we thinking of instilling coaching into clinical practice? There's quite a bit of evidence to show that students do better and do rapidly develop confidence, leadership, take on greater responsibility for their learning within their clinical practice than those undergoing traditional supervision in clinical practice. So those who are coached rather than taught or mentored develop sound clinical reasoning and decision making skills and increase their preparedness to take on the role of registered nurse. And for these reasons we're really interested in instilling this into our programme. So at the moment mentors are being trained to develop coaching techniques. The Nursing and Midwifery Council changes will require students to be coached by supervisory healthcare professionals, and they require students to graduate with coaching skills to be expected as part of registered practice. So we're moving in the direction of where the NMC are expecting us to be. So regardless of what stage, a student can coach each other, and junior and senior students can coach junior students, both in clinical skills simulation and in the clinical setting. It is a matter of stepping back and to enable people to think, and your peers, about what it is you're doing, why you're doing it, and what you should be doing, rather than the follow me kind of philosophy that we see quite a lot current in practice. Our university is advocating the GROW model of coaching, and we're teaching both students and mentors this. So what's that? It's a simple model. It's setting goals, which is what we commonly expect our students to do anyway. Where are they now? What is the knowledge now? Or what's happening in practice? What needs to be done? So what could be done? So should I do this? Should I do that? Could I do this? Could you do that? And then what will you actually do? So it's that reasoning based on evidence and prior experience that's really key. So it could be applied to the whole placement, or a day's activities, or an hour's activities. Right, what do we want to do with these patients in the next hour? It can be used in theory, when looking at when exploring practice, case studies, or other activities that students may engage in the classroom. So starting this year, Year 2 and Year 3 students have been provided with a log on their PebblePad portfolio to record any coaching activity they undertake, and it can be used for evidence for Domain 4 in leadership and management. Opportunities will be created to enable students to coach each other or to coach junior students. In Year 3, Domain 4 requires students to demonstrate the ability to facilitate learning in others, which this would fit in very nicely with. What we also aim is that they'll be able to take the evidence into registered practice, enabling students to coach and supervise students and be assessed as competent and proficient at mentoring or supervising or assessing students in the future. So how do we think about actually really putting it into practice? So these are the goals, the cues, and here's some little ideas about what could be done. So where are you now? What is different? What do you want to achieve? How do you feel about that? What you're going to get from the goals that you're setting? How does that impact on others that you're working with? The options, where you could find things from, what you can do, how you can plan what you can do, and what actually happens. And is there anything that needs to be put in place? So looking at some examples, we're asking our students and our mentors to discuss with each other how this using the goal reality option and what will be done, the GROW model, is actually thinking about how this could best address these particular scenarios. What we want to think about is how that could actually be turned into a learning experience. So when you've done all of those things and reflect back on how did I do and where will I go now. So in other words, what will you do brings you back towards your goals. So what can you do now? What would you do next time this came across? And this is focusing on the art of reflection and reflective practice. So using the GROW model, it beds in the reflective practitioner, helps students to develop those skills and to develop skills of critical reasoning and clinical decision making, being coached and encouraged by another to work it out and work their way through. I'm now moving on to collaborative learning practice, collaborative learning zones and hubs that are being developed across the Southwest. So quite a few of the placement providers in the Southwest are starting to develop learning zones, learning hubs, learning environments. This is starting off predominantly in ward-based care, and there's a lot of discussion about how we can work together to roll this out with allied health professionals and doctors. So where does it fit into what we've been talking about? So we know that create collaborative learning environments enhance students' learning experience and enables higher quality supervision using coaching as a basis for it. We know that clinical areas and clinical teams are having problems and difficulties recruiting, and what we do know is that the places that run collaborative learning and practice have high level recruitment based on the experience that students have. This will actually increase capacity to secure the future of the profession. So let's have a look at it more closely. Please have a look at this presentation and go to the YouTube presentation. It will give you a video of students' experiences in collaborative learning practice. But in essence, a group of students are allocated to a team on a daily basis, maybe 1 or 2 bays, and the remainder of the ward continues to function. The students will work with a number of staff who would normally allocate to the patients. So if the students weren't there, then the care would continue. However, the students work in groups. They're supervised by a registered nurse, or they may be supervised through a support worker, using coaching techniques to facilitate the learning. So that step back, what do you think you should do? What are your plans for the day? Using the GROW model. The students are allocated total responsibility of 1 or more patients, depending on experience. Usually first years allocated 1, and second, third years 2, 3, 4, and so on. They work together as a team collaboratively, coaching each other as well as they are, and taking that step back and observing and coaching and doing giving clinical care that they may be required to do, such as drug administration. What it does is creates that collegiate development of skills, and it puts the student in front, and it gives that enables them to have a holistic approach to care, because what we've discovered, a lot of students will give us feedback that they'll do bits and pieces of things, but quite often other people will do things, whereas they're put total charge of what they're doing. What we found is it doesn't occur at night shifts because of the skeleton staff that you probably have, and it's ideally that once a week the students will come together and reflect on how their week's gone. Each student is allocated a mentor, but they may not work that frequently with the student. Whoever is working and coaching them are the people who provide information for the assessment. Mentors will still set goals with students, do formative assessment, summative assessment, but they are taking more of a back seat in terms of working with an individual student. As long as a mentor is available for a student for sort of 40% of their working week, then everybody has a point of contact for advice should they need it. So there were teams of academic practice leads who went to Lancashire Teaching Hospital to see CLIP in practice, and here are some of the things that they felt. There was that holistic approach to care. First year student was really excited because they had dialogue with a consultant about their patient's care, and they'd only been in practice for 2 weeks. All the students were majorly enthusiastic about their experience. They displayed high levels of confidence and also feeling that they were really developing a lot quicker than they would in a traditional care setting, a traditional mental student setting. We met Percepti, who was coaching students, and felt that she had lots of confidence. She had come through the coaching system and chose to work in that environment because of how much it was, but she couldn't believe how confident she was in enabling students to learn using coaching. Thank you for your time and listening. There are references there, and also I highly recommend that you watch the video. This is just a briefing and an introduction. More detailed information will be provided for students who are actually going to be working on collaborative learning areas.